Hi friends, in this video we are going to see about the cervical spondylitis and the spondylosis. One of our Bangalore student asked me to give some brief explanation about the cervical spondylitis. So you have to understand the difference between the spondylosis and the spondylitis. What is cervical spondylosis and what is cervical spondylitis? When you see the symptom, both are having the same symptom. Both in the cervical spondylosis and the spondylitis, we will have sometimes same symptoms like cervical pain, stiffness of the neck, then headache, giddiness, and tingling sensation in our extremities. That will happen. So what is the difference between the spondylosis and the spondylitis? So we are having our spinal column. In the spine we are having vertebra. So the inflammation of the vertebra is called cervical spondylitis. It's like an arthritis. So spondylitis is an inflammation. So the material between the vertebra, that is called disc. Sometimes the disc will degenerate. That condition is called spondylosis. So I have to understand clearly, inflammation of the joint or inflammation of the vertebra is called cervical spondylitis. Degeneration of the vertebra is called the degeneration in the disc is called spondylosis. So this is because of the wear and tear. Due to age it will come. This is the normal simple understanding, simple explanation about the modern science, right? So in our acupuncture, the TCM, how we can what is the cause for the both, whether it is cervical spondylitis or spondylosis? In general, we call it as kidney yin deficiency or kidney essence deficiency. So kidney is the in charge for the bone. So kidney takes care of our bone health. So when there is a problem in the bones, so it clearly shows there is a deficiency or imbalance in the energy of the kidneys. So in general we call kidney deficiency, that means kidney yin deficiency and kidney essence deficiency. This is the first primary cause. In the degeneration, we clearly say this is because of kidney yin and kidney essence deficiency. Right. Sometimes only the pain will be there. So in general, in acupuncture we call all the pain symptom as B syndrome. That already I covered many B syndromes. So here the pain is called as B syndrome, coming under the B syndromes. So what is the cause for the pain? Normally the energy flow blockage, either the chi blockage, the circulation of the chi or circulation of the blood causes pain. So the channel, what are the channel? Gallbladder channel, urinary bladder, SI channel and triple omer channel. Many things are crossing here. Mostly all the yang channel is crossing in the 214 area, that So blockage of the chi of any channel which is crossing the neck area, that gives pain. So here we can say the second cause for the cervical spondylosis or spondylitis, for pain in the neck area or spasm in the neck area, we can say stagnation of the chi or stagnation of the blood. So the main two reasons, one is for the degeneration, kidney is the problem. So kidney essence or kidney yin deficiency is the cause. Second, the pain due to the chi blockage or the blood blockage, that you have to understand, right? Apart from these two, we can consider the third thing from the external. That is the feng, the wind, the evil wind is the cause for the cervical pain. The accumulation of evil wind in the areas, so that also gives a pain of the neck, pain in the neck area. So the evil wind is the third cause for the cervical spondylitis or spondylosis, whatever may be. That simply understand accumulation of wind, that is the wind may be here cold wind cold, we can say as wind cold, or dampness, wind dampness. When the wind is coming with cold, that is called wind cold. When it mingles with the dampness, it is called wind dampness. Both dampness and the cold creates the pain. So the third cause is external cause, that is the external pathogen. Wind is the main cause. So evil, that we call it as evil wind. So for the problem of cervical spondylosis or spondylitis, we have to treat based on the pulse diagnosis and time diagnosis and symptomatic, whether it is degeneration of the discs or vertebra, we have to treat the kidney essence, or simply pain only, stagnation of energy or stagnation of blood, or this is because of the accumulation of evil wind due to cold or due to dampness, we have to treat accordingly. Okay, so here we can use acupuncture and the moxibustion. For kidney essence and kidney yin deficiency, we have to treat kidney. Okay, so here we can use kidney points, kidney source point. K3 is very important point and K7 very important point. Then to reinforce the kidney energy, we have to use Do4 and UB23. These 4 points are very important points treating the kidney yin and kidney essence. Don't forget, I'll once again repeat: Do4, UB23, kidney 3 and kidney 7. These 4 points very important points to treat the kidney deficiency, that means kidney yin or kidney essence deficiency. Okay, so to treat the chi stagnation and blood stagnation, we have to treat the triple armor channel. Triple armor, triple armor is the in charge for the smooth flow of the chi. So for that we have to select triple armor 4 or triple armor 5, right? Then local points, Feng Fu, Feng Chi. This is very important 2 points normally. So that is GB20 and Do 16, both 2 local important point. Then UB10, another important point, UB10. Do 14 also, normally we treat Do 14, that's a local point, effective point, balancing point. So GB20, Do 16, Do 14, then UB10. These 4 points for the local effect. Apart from this, we have to treat LU7, the distal point for the occipital area, LU7. Then in general for treating the pain, Li4. So this is the treatment for the cervical pain or cervical spondylosis or spondylitis. Okay, so in spondylosis we have to definitely treat the kidney because that is the cause. In spondylitis, inflammation, we have to reduce the pain and we have to balance. So for that we are using Li11 and SP6 also. Both are the very important point in treating the inflammation, right? Here we can treat, we can use moxa also if the problem is because of the accumulation of cold wind or dampness. The set points, what I told, the points GB20, Do 14, Do 16, UB10. In these points we have to apply moxibustion instead of needle. So to clear the dampness and the cold, we have to give moxa in those points. So in acupuncture we can give excellent result for the cervical spondylitis or spondylosis. Okay, so treat according the symptom, according to the diagnosis, how you diagnosis, what you diagnosis. Based on that, select the points. Okay, we will meet in the next video in some other case. Thank you.